What we've really seen is a potential impact of billions of dollars for hospitals.
That's the state's Medicaid director at a rally in Lansing today. The Michigan Families for Fair Care organized the event outside of Sparrow Hospital. On Capitol Hill, the House has passed a proposal which would leave people without coverage. And this past week, Senate Republicans drafted an even bigger cut to health coverage into that bill. People at the Lansing rally are expressing their opposition. Cuts to Medicaid from the nation's capital would impact millions of people. The proposal right now would add certain rules and requirements for those on Medicaid. Republican lawmakers like Michigan Congressman Tom Barrett have said this gets rid of fraud. However, the state's Medicaid director says she's concerned about how it will possibly leave people uninsured.
1 in 4 Michiganders being covered by Medicaid, that's something that really impacts all of us.
I'm on Medicaid because I'm on disability.
Peggy Wiles stood outside Sparrow Hospital on Friday afternoon. She's very concerned about the possible cuts.
If they cut my Medicaid, I wouldn't have food stamps, and I wouldn't have a secondary insurance for I have specialists I see.
Medicaid was established in 1965. It provides health care to low-income adults and children.
There's a lot of elderly that really need it, and other people that are down and out.
According to the Congressional Budget Office, the spending bill would reduce Medicaid by $793 billion. A little more than 10 million fewer people would be enrolled.
The greatest payer of mental health services is Medicaid, and if that gets cut, then we're going to have real problems with that.
There's concern over where people would turn if they didn't have care, especially, as Margaret Keeler says, those who need mental health help.
People don't have private insurance. A lot of folks don't, and so it is important to have a safety net such as Medicaid.
Michigan hospitals would also be impacted.
We're the largest payer for hospitals, certainly, but like when you're looking at long-term care, behavioral health services, births is the one piece where I will say in terms of we are definitely the largest payer.
The bill passed in the House last month, and now it's in the Senate. Earlier this week, Senate Republicans proposed even tougher restrictions for someone to be on the health care plan. Some Republicans in the Senate have opposed those cuts.